My name is Dr. Joshua Jue. I'm one of the robotic and minimally invasive urologic surgeons here at Palm Beach Health Network. Today we're going to be talking about kidney stones. Patients need to know that about 10% of the population has kidney stones. A lot of times patients can be asymptomatic, or in other words, not know that they have kidney stones. And sometimes, unfortunately, the time that they find out is when the kidney stone drops from the kidney into the ureter. The kidney is the organ that makes the urine, the bladder stores the urine, and the ureter is the tube that connects the two. And unfortunately, that's when the patients feel excruciating pain and then come to the emergency department. Problems include severe infections that can be life-threatening, can also cause decrease in kidney function, which can sometimes be permanent if left untreated. So there's a lot of great options now for kidney stones. They range from watching the kidney stone and letting it pass and avoiding surgery. That's usually the best option for patients if they can tolerate it. There's also ultrasounds, where there's extracorporeal shockwave lithotripsy, or in other words, an ultrasound on the patient's backside where ultrasound waves and sound waves are used to break up these stones and allow the fragments to pass. There's ureteroscopy, which is a very small camera that goes in through the urethra and stays in the urinary tract without any incisions or wounds, where the kidney stones are fragmented and broken up with a laser, and these fragments are removed afterwards with a basket, or the stone is broken up into such small pieces, usually the size of dust, and this dust usually passes on its own or is removed through a vacuum device. There's also percutaneous nephrolithotomy, or in other words, a very small 1 centimeter incision on the patient's backside, where we go in through the back and then use a camera and another instrument to remove these kidney stones. There's been a lot of advancements in this procedure recently, where we can do this with minimal patient positioning that is less risky for the patient compared to the standard way before. We also can gain access into the kidney now with an ultrasound and minimize radiation exposure to the patient. We can also use smaller and smaller incisions in the back, so if 1 centimeter incisions weren't small enough, we can do them with 0.5 centimeter incision. We're happy to be able to offer the newest treatments. The vast majority of treatments for kidney stones that I mentioned, whether it's the ultrasound on the backside, whether it's the small camera through the urethra without any incisions, those patients often, if not always, go home the same day. Vastly different than how kidney stones were managed decades ago, with a large open incision and several days in the hospital.